Okay, so first I want to welcome everybody. My name is Dr. Marc Adelsheimer, and I want to thank you for joining me tonight on our webinar. Hopefully this will be very informative for folks. And the purpose of tonight's webinar is just to let you know some of the great things that we're doing in our practice, and hopefully this will make you interested and want to come see us and see if we can help you out. I will have as much time as necessary at the end to answer any questions that may be out there. But we're going to get started with the presentation. So I'm going to share my screen. And again, if anybody has any questions, you can either write them down and I'll be happy to look at them that way, or we can just talk at the end and answer the questions that way. But I'm going to go ahead and get started. Okay, so again, the title of tonight's talk is how you can avoid surgery and reduce pain. We're going to be talking about regenerative medical treatments, and these are using your own platelets and your own stem cells to help heal your own problems that you may have. So again, I want to introduce myself. My name is Dr. Marc Adelsheimer. I'm from Pittsburgh. I did my undergraduate degree at Duke University. I got my doctorate of medicine at Medical College of Pennsylvania, and then I did my training in Boston at Tufts University. I graduated from residency in 1995, and I moved back to Pittsburgh in 1996, and I've been practicing in Pittsburgh ever since. Pittsburgh is where I was born and raised, and it's been great to be here for my entire practice. My spare time, I like to play a little golf. Here's a picture of me with my two partners, Dr. Paul Lieber and Dr. Jesse Sally. All three of us are from Pittsburgh. We're all board certified in physical medicine and rehabilitation. We have office locations in 5 different parts around the Pittsburgh area. Our main office is in Fox Chapel or RIDC Park, and that is where we perform most of the procedures that we'll be talking about today. But we also have satellite locations in Monroeville, Bridgeville, Washington, and Sewickley, where we can do evaluations. So why are you here? Why is everyone interested in what we have to talk about? Because you have pain and you're looking for options. You don't want to rely on medications to help deal with your pain. You don't want to have to just learn to live with it. You're not ready to slow down, and you want more from your life. You don't want to have a lot of downtime. You'd like to avoid surgery, or maybe you're not a surgical candidate. So these are the type of things that we're going to be talking about. But really, our purpose is to help you improve the quality of your life. So whether that means going out and playing around the golf, swimming, or doing other recreational activities or high-end sports activities, really just enjoying your time, spending time with children, grandchildren, and just having a more active lifestyle. This is an agenda of what we're going to be talking about tonight. First, I'm going to introduce Regenx, who's a company that we're partnered with. We'll be talking about different options that Regenx has to offer. We're going to talk about interventional orthopedics, which is really what the whole purpose of tonight's talk is. We're going to talk about different body parts that we can help treat and who is this for. We'll go over some of the results that we've seen in our practice. We'll also talk about the differences between Regenx and what we have to offer and some of the other providers out there that are now doing regenerative medicine. So Regenx is where orthopedic stem cells were invented. It was founded in 2005. It was the first clinic on earth to begin treating orthopedic conditions using precise stem cell injections. Regenx is a national group of providers. There's actually 70 to date. This is a little bit of an old slide. Every Regenx provider is a physician. They're all either MDs or DOs. So we do not have any nurse practitioners, physician assistants, or chiropractors in our network. And everybody is trained the same way to perform high quality procedures. And that includes prolotherapy, platelet-rich plasma injections, and stem cell injections. And that's going to be what we're going to talk about. Regenexx is therefore not a product, but a family of medical procedures. And what Regenexx does is a new medical specialty, also known as interventional orthopedics or regenerative medicine, which is a way of helping you to help to heal yourself. So it's not adding on to an existing surgical procedure, but it's a new way of approaching orthopedic problems, how you can heal yourself without surgery. So what's the goal of interventional orthopedics? It's to use less invasive procedures to avoid the more invasive surgeries. Let the body heal itself. Surgical orthopedics will not be the dominant form of care in the 21st century. Most meniscus surgeries are not necessary. In fact, 95% of meniscus surgery are removing an important space in the meniscus, and all this is doing is leading to the development of arthritis. So research now shows that removing this meniscus actually does harm. It's not even about healing the problem that you may have. It actually causes problems. It makes your knee worse. And this is just one example of surgery that can actually cause harm as opposed to promoting healing. So let's stop cutting stuff out and instead injecting your own cells that can help your own tissues heal. Because of biologics or interventional orthopedics is changing and will continue to change. In the year 2000, almost everything with orthopedics was done surgically. By 2015, this gap had changed a little bit, but this is where things are heading in the future, where about 2/3 of current orthopedic surgeries will be able to be replaced with interventional orthopedics. And this is what we have to offer in our practice, is non-surgical treatment for orthopedic conditions. When you're doing non-surgical treatment, physicians are trained in how to place needles accurately. 50% of physicians are never trained. They have no idea how to stick a needle into someone. So if they are sticking a needle into your knee or your shoulder, they're basically doing it blind. They don't know what they're doing and probably shouldn't be doing these procedures. Another 45% of physicians have had some minor training where they can possibly were taught during their residency or training how to stick a needle in. Hopefully they were taught how to do this under ultrasound, but they really weren't taught appropriately, precisely. Whereas only about 5% of physicians actually know how to do precision guided interventional procedures, and every Regenexx provider has been taught the highest level of interventional orthopedics. So again, very few physicians actually know how to do these procedures. There are different treatment types, and we're going to get into these in more detail in a few minutes. I'm not going to talk much about prolotherapy other than to explain where we use it as part of our stem cell treatment, but I'm going to talk more about same-day stem cell treatment and about PRP and platelet lysate procedures. So let's start talking about what different cells that we're going to use and why we use them and how we're going to use these cells to help to heal your own tissue. So basically there's two cells that we're using. One is the platelet and the other is the adult mesenchymal stem cell. So what's a platelet? A platelet is a blood cell. It contains healing growth factors. It helps to speed up the repair of tissues. It also contains a substance known as serotonin that helps to calm down pain. Platelets also attract stem cells and help to activate them. So we use platelets in two different fashions. One is known as PRP, or platelet-rich plasma. We also call it SCP at Regenexx, which stands for super concentrated platelets. And we use platelets very commonly to help heal many orthopedic conditions, especially more mild conditions, things like tendinitis. It works great for golfer's elbow, tennis elbow, Achilles tendinitis, rotator cuff tendinitis, ligament sprains, things like a medial meniscal tear, an ankle sprain. It can work on cartilage and more minor joint problems. When you inject platelets into joints, the growth factors are released slowly, and they help to heal in a slow, concentrated fashion. So platelets are very commonly used in orthopedic practices. In fact, almost every orthopedic practice now offers PRP. However, you'll see in the next slide that here at Regenexx, we have a significantly superior PRP product that we offer to our patients. We also use platelets to help treat damaged nerves or injured nerves, especially when we're doing spinal procedures. So if we take the platelets and we lyse them and we create something known as platelet lysate, this can help to treat nerve problems, especially entrapped nerves in the back, such as radiculopathy or sciatica. We also use it to treat entrapped nerves in other parts of the body, like carpal tunnel syndrome or ulnar neuropathy or tarsal tunnel syndrome. Platelet works very well to help heal all of these problems. So as I mentioned, PRP is extremely common now, especially in the orthopedic community, in the sports medicine community, and not all PRP is the same. The main difference is in the processing that we have at Regenexx that other practices do not have. We have a high-level processor in our facility that is able to concentrate platelets to 20 times a factor, whereas the bedside machine that they have in orthopedic practices can only concentrate them to 5 or 7 times. As a result, they're leaving a lot of red blood cells in. So standard PRP, or what you see on the left, looks bloody because it still has red cells in it, where our PRP is opaque because it is pure concentrated platelets. What does that mean? That means that if you're getting PRP with us, you're getting a superior product. Not only are you having a physician who knows how to do these injections correctly, but you're actually getting a better product injected into the damaged area. Next, I'm going to talk a little bit about stem cells and what is an adult stem cell. So a stem cell is a mesenchymal cell that's an undifferentiated cell that's held in reserve until it's needed to help heal various parts of the body. We have billions of stem cells in our body. They have the ability to turn into many different cell types. The main place that we have stem cells is in our bone marrow and in our fat. Stem cells can orchestrate a repair response if you can concentrate these and place them into the correct location. So they are the repair cells that are held in reserve until needed to help repair damaged tissue. They renew themselves. So people say, hey, if you take out all my stem cells, what's going to happen? I'm not going to have any more. No, that's not true at all. Your body will regenerate every cell that we take out of you within a month. So you can go on to have a second stem cell procedure 2 months later, 3 months later, 5 years later. So they are self-renewal. That's a very important concept, especially because there's other practices out there saying that, hey, if you inject a 70-year-old person, you're injecting 70-year-old stem cells, and that's 100% not true. You're actually injecting stem cells that are about a month old. They also provide new blood supplies where they are injected. So at Regenexx, we are discussing adult, not embryonic stem cells. We are only using your stem cells, autologous mesenchymal-derived stem cells. Again, mesenchymal stem cells come from bone marrow or fat. We have done both in our practice. We pretty much only do bone marrow now, and I'm going to tell you why later on in the talk. So let's talk about first what's involved with the stem cell procedure and what to expect if you decide you want to do a stem cell procedure. And I'm going to kind of go into the different treatment that's involved here. I also have a little video that I'm going to show to you folks, because a lot of people have concerns when you're doing a bone marrow aspirate, and I videotape myself doing one with the consent of my patient, and I will show that video in a few minutes. So before we get into actually doing the procedure, the first step is to make an appointment. you come see me in the office, Dr. Sally or Dr. Lieber, where we'll do a comprehensive history and physical. We will review your diagnostic testing, such as x-rays, MRIs, or any other tests that you may have. If you don't have the appropriate test, we can order that for you. And then we will go over options and develop a treatment plan for you. If that treatment plan is a stem cell procedure, it is a 3-step process, and that's what this slide is showing. The first, and the analogy of this 3 steps are like planting seeds in your garden. So on the first day, you come in and you will get prolotherapy. As I mentioned, prolotherapy is a regenerative treatment that we still do in our practice. And the reason we do prolotherapy before the stem cell treatment is because prolotherapy acts to till the soil or to make the area ripe and rich. So you'll come in, say, for example, we're injecting your knee. You'll lie down on a table. We'll use an ultrasound machine. We will inject prolotherapy into the knee. It takes about 10, 15 minutes to do. You get up and you leave, and that's it. You don't need to give us any blood or bone marrow that day. It's a quick and easy procedure. The prolotherapy will start an inflammatory reaction in the joint, which will make it ripe and rich. So we put the stem cells in a few days later, they stick better. The second appointment is the big day, and that's what I'm going to show you in a minute, and that's the stem cell day. And what this slide is showing is where we get the stem cells from. It's showing a picture of a needle going into the pelvic bone. That's where we get the bone marrow from. It is a very safe and easy process. I've done personally over 1,000 of these. Our practice has done over 3,000. They are all done either under X-ray or ultrasound, and I will show you what it's like to get this done under ultrasound, and that's my video I have next. So this is, I know that I turned it a little bit, it's a little bit too long, but basically what I'm doing there is I just put a needle in, and now I'm numbing up the bone underneath. I'm using my ultrasound probe. In the back, you can see what I'm looking at, which is here's the bone, and there's my needle coming in, so I'm numbing up the bone. The patient is lying prone. You're seeing the back of her head. You're seeing a little bit of her exposed back. As you can tell, I'm not going into her spine or into her hip. I'm just numbing up the pelvic bone. She's tolerating this very nicely. And once the entire bone is numb, then we're going to switch needles here. This needle is, again, pretty thin. It goes in very easily. I push the needle down till I come up, and I'm watching it under ultrasound to make sure I'm coming up to the right part of the bone. You can see it coming. I can see it coming in, but it's coming in right there. It's kind of touching on the bone. I see it. It's in the right location. I can feel it also. And then I use a small drill, click it on. The needle goes in. Easy peasy. We take out the stylet, put in a drop of heparin first to make sure it doesn't clot. And then this is me extracting bone marrow from that location. And you can see I'm filling up an entire 30 cc syringe. We actually get about 60 to 90 cc's of bone marrow because we will get it from both sides of the pelvis. As you can see, this patient is not sedated. They are totally awake. This is done under local anesthesia. They're very comfortable, no pain. And that's basically what's involved with the bone marrow aspect. Once we get the bone marrow, let me go back. Once we get the bone marrow from your spine, then we take it to our lab. Our lab technician, as I said, I get about 90 cc's of bone marrow on average. From that, we will get about 5 cc's of stem cells. So about 95% of what we extract is blood cells that we do not want to re-inject. So it takes my staff about an hour and a half to process the bone marrow, during which time you leave, you go get breakfast or lunch, depending on what time of day you're there. And then you come back, and then under X-ray guidance, we will inject the stem cells into whatever joint we're treating, be it a knee, shoulder, hip, ankle, elbow, or other joint in the body. That's day 2. Day 3 is usually 2 days later, and that's done with PRP, or platelet-rich plasma. As I mentioned, platelets act like, can stimulate stem cells to work better. So they act like a fertilizer to the stem cells. So you put those in a couple of days after, and then they're fertilizing the cells that are already in there. So again, the 3-step analogy is tilling the soil, planting the seeds, fertilizing the seeds. And that's what's involved with the stem cell procedure. After that, you do not have to come back to the office for any more injections. All of our patients go to physical therapy afterwards, and they begin, they're taught an appropriate exercise program, because the stem cells are going to make the joint healthier and stronger, but then you need to work on the muscles to make that healthier and stronger afterwards. So I'm going to talk in a minute about different areas of the body that we treat with stem cells and with PRP. But first and foremost, is it safe? Because, first, do no harm. And the answer is yes. This is a very safe procedure. All we are doing is taking some of your cells from one part of your body and moving them to another part of your body. Every needle we stick in you is done guided, meaning under ultrasound or X-ray guidance. These are only done by physicians who are highly trained in doing these, physicians who have done thousands and thousands of these injections. We have never had an infection, and we've published data from Regenix to show that we have never had any significant complications. If you're comparing this to surgery, the opposite is true. You can see the best surgeon in the world in the best facility, there's still a high risk anytime you're operating. And it could be as bad as death, heart attack, stroke, infection, nerve damage, blood clots, all these things can happen with surgery. So next I'm going to go through the 4 most common parts of the body that we treat and some of the most common diagnoses. But again, we treat all orthopedic conditions. So if I don't touch on a condition that you're interested in tonight, just please come and see us and we can address other conditions in the office when you come in. So I'm going to start with the knee. And the reason I'm starting with the knee, it's the most common joint that we treat. And that's for 2 reasons. Number 1 is it's one of the most common problems, if not the most common orthopedic problem that people have. But number 2, and more importantly, knees do great. Even people with bone on bone, end stage, I need a knee replacement tomorrow, bad knee, you can undergo a stem cell procedure and expect to have a significant improvement. On average, we're seeing a 66% improvement for people with end stage bone on bone arthritis. So that is very significant. Knees are a home run. We have done these on people well into their 90s, including a 98-year-old gentleman. We've done these on morbidly obese patients that were not candidates for surgery. We've done these on people that have other medical conditions that may not make them a candidate for surgery. So again, osteoarthritis of the knee is the #1 condition we treat because it does extremely well. Other conditions that we can treat in the knees includes meniscal tears, and often just a small meniscal tear, we don't even need stem cells, we will use PRP because PRP works really well for meniscal tears. On average, we see about a 90% improvement with torn meniscus. And one of the newer procedures we've been doing the last few years are ACL tears. And I actually have a picture of someone with a torn ACL that we treated with stem cells, and the ACL regrew. So that is extremely exciting stuff that we're doing with knees. This is just a typical patient in our practice, Pam, who's a 58-year-old aerobic instructor. She had 4 years of severe knee pain and grade 4 or end stage bone on bone arthritis. Her pain was 6 to 8 out of 10. She wasn't able to work. She received a stem cell treatment in her right knee. And within 6 months or within 3 months, she had returned to full duty work, including aerobics, yoga, Pilates, plyometrics, and had basically no pain. An MRI done on her a year later showed that she had regrown some cartilage and she no longer had a grade 4 chondrosis, it was now a grade 3 chondrosis. More importantly, wasn't how much cartilage she regrew, but more importantly, her pain went down to a 1 out of 10. And most importantly, she resumed working and resumed her lifestyle and got her life back. She wasn't able to work. She wasn't able to do the things that she enjoyed. And after undergoing a stem cell procedure, she had gotten her life back and she was extremely happy with that. This is a picture of the ACL, showing a torn ACL here and a repaired ACL, same knee, after undergoing an ACL stem cell treatment. So it actually can regrow certain tissues, especially things like a ligament, as long as the sheath is intact, and this patient's sheath was intact. Moving on to the shoulder, this is probably the second most common joint in the body that we treat, and we treat a number of different conditions in the shoulder, including rotator cuff tears, labral tears, tendinitis or tendinosis, and arthritis of the shoulder. Depending on the severity of the condition, we can sometimes offer PRP only, especially if you just have rotator cuff tendinitis or bicep tendinitis. But if you have a torn rotator cuff or a significant labral tear or severe arthritis, then you would be looking at a stem cell procedure. And stem cell procedures for a good candidate in the shoulder, on average, are seeing about an 80% improvement. So shoulders can do very well as long as it's not an end-stage bone-on-bone, no motion condition in the shoulder. Even severe arthritis can be treated very well with stem cells in the shoulder. This is a picture of an MRI of someone with a torn rotator cuff. There's an arrow here pointing to the tear. And this was after a stem cell treatment showing that that had healed. The third most common area we treat is the hip. In the hip, there's basically two different conditions that we will treat. One is osteoarthritis, which also goes along with labral tears. And the other is avascular necrosis, which will require drilling into the bone and can also lead to a favorable outcome. Now, the hip is a little bit of a tougher joint to treat than the shoulder or the knee, especially than the knee, meaning that you have to be a little more careful in people that have severe arthritis. People with end-stage severe bone-on-bone arthritis are probably not going to do very well with a hip stem cell procedure. However, if you have mild to moderate arthritis, the outcomes can be extremely good. So we still treat a lot of hips in our practice. It is totally a misnomer that it doesn't work in hips. It just doesn't work in severely end-stage, too far gone hips. But that's something we can determine for you. We will do a consultation and let you know if your hip, whether or not you would be a candidate for this or not. We still do a lot of hips in our practice. The patients that have hip procedures with us, about 75% have returned to active sporting activities, which is a lot better than a lot of people undergoing hip replacements. As I mentioned, we treat avascular necrosis, and this requires drilling a needle down into the bone. This is a picture of a needle in the bone. What happens with avascular necrosis is part of the bone dies by losing its blood supply. So we can treat that by putting stem cells into the bone to help that bone heal from the inside out. We also will do drilling of the bone in the knee or the shoulder, depending on the severity if necessary. So the last area of the body I'm going to talk about, and one of the most common areas that we treat, is the spine. And we treat all spine conditions. In fact, Dr. Lieber and myself have been treating spine problems for close to 30 years with interventional procedures. In the past, we both did thousands and thousands of epidural steroid injections and rhizotomies and nerve blocks. We have basically abandoned those procedures because regenerative procedures in the spine work so much better. So whether you have sciatica from an irritated nerve root, a painful or herniated disc, whether you have facet-mediated pain, ligamentous pain, spinal stenosis, or prior surgery, these are all conditions that we can treat in the spine. So instead of doing our epidural injections with steroids, we now use platelets or platelet lysate. Most specifically, as I mentioned, the platelet lysate is what helps to heal in all of our epidural injections, again, using platelets instead of steroids. And this slide shows why, because when you're doing a epidural steroid injection, on average, by 3 months, they're gone. By 6 months, they're all gone. Whereas an epidural platelet lysate injection, people have significant improvement that lasts for months and even years. So they work better and they last longer. So I'm going to talk next about how Regenexx compares to other providers that are out there that are doing, quote, regenerative medicine or, quote, stem cell treatments. A lot of these treatments are, number one, not FDA approved. Number two, do not have research to back them up. And I'm going to talk a little bit about the Regenexx difference. So first, let's talk about amniotic stem cells versus adult stem cells. As I mentioned, we're using adult stem cells. When you go to a provider and they're saying to you, hey, we have amniotic or stem cells from a baby, they really don't. All they're using is amniotic fluid that has been frozen, shipped across the country, unfrozen, and then put into a syringe. These have been analyzed in various laboratories and have shown that there are no live stem cells in any of this tissue. It's mostly baby urine. There's also no data to support using amniotic fluid or cord blood. They also are using the blood from the cord of a pregnant, from the placental cord or from the placenta from a pregnant woman, and there are no live stem cells in any of this. As opposed to what we're doing, we're placing in live adult stem cells that will help to heal your problem. Also, a lot of these, quote, stem cell procedures are being performed in chiropractor's office. There are no MD. There's no guidance. They don't know what they're doing. They're blindly sticking needles into you, usually done by a PA or a nurse. And the costs are significant, yet there are no data to help support what they are doing. So the FDA has been looking very closely at these clinics. A number of them went away during the pandemic, but there are still some clinics out there that are doing amniotic or cord blood. I would highly, highly recommend, if you don't do a procedure with us, not to do a procedure with them, because it is basically voodoo medicine without data, and you're going to be charged a lot of money for something that is not going to help you. The FDA has also been cracking down on clinics that are using fat. As I mentioned, we originally were doing both bone marrow and fat, but now we have switched to pretty much exclusively bone marrow for two reasons. Number one is that the FDA has looked at it, and number two, fat works a lot better. I mean, bone marrow, sorry, not fat. Bone marrow works a lot better when compared to fat. And we've done a lot of research to compare this. There's actually 10 to 20 times the number of mesenchymal stem cells in bone marrow than there is in fat. So you're going to get, again, a much superior product if you're going to use bone marrow as opposed to if you're going to use fat as a source of stem cells. There have been a number of different studies comparing these head to head, and all of these studies basically come to the same conclusion, that bone marrow is better than fat. And again, I said our procedure can get you about 20 times the number of stem cells that you can from a fat procedure. They said my stem cells were too old. I kind of mentioned this earlier. That's 100% untrue. Stem cells regenerate every month of your life, meaning that you're turning these cells over all the time. We have done multiple patients in their 60s, 70s, 80s, and several in their 90s who have done very well with an adult stem cell procedure. So that is a total misnomer. Again, their treatments contain dead cells, nothing alive. So what's the downside to all this? For most people, it's that it's not covered by insurance. We've been doing this now for about 10 years, and there are a lot of self-insured companies now over the last 2 to 3 years that are now starting to cover these procedures. But for most people who have traditional health insurance, be that Medicare, Highmark, UPMC, Aetna, they are not covering the actual procedure. However, if you look at what you would have to pay if you were to do this out of pocket, comparatively, with having knee surgery, you're probably looking at very identical costs. Insurance does cover the consultation, meaning coming to see us in the office, spending time with myself, Dr. Lieber, or Dr. Sally. We'll bill that through. We take basically every health insurance in Pittsburgh that's available. They will cover your follow-up visits with us. We'll cover any testing that we order. We'll cover the bracing and any physical therapy that we order. What they don't cover are those 3 steps that I talked about, just the actual procedures themselves. Why they don't cover that, that's an entirely different talk. And a lot of it's political, but as I said, self-insured companies are now covering these. And the reason they are is because of this. They're able to save significant costs. So even if they spend $7,000 for a stem cell procedure, they're able to avoid spending $50,000 for a knee replacement. So depending on what procedure you're looking at, costs can vary. Not all stem cells are that much, some are less. We would go over this in detail with you, but it is important that you recognize that traditional health insurance doesn't cover the actual procedures themselves. So to conclude my talk, Regenexx isn't magic pixie dust stem cells. These are advanced, precise, safe interventional orthopedics using your cells to help to treat your body. When I say we, part of Regenexx has been doing this longer than anyone else in the United States. We have more treatment options to offer to anybody than anybody else. And we publish with an online registry more than anybody else. We also use our resources to stack the deck in your favor. What does all that mean? It means that you're going to get the best regenerative treatment that you can possibly get through Regenexx. So how do I get started? Again, the best way is to just come to see myself, Dr. Lieber, or Dr. Sally in one of our office locations. We do consultations in the various locations that I talked about earlier. So you have nothing to lose by scheduling an appointment. We see a ton of consults every day, and we will give you an honest opinion. We will spend a lot of time with you, do a comprehensive a history and physical exam. We will look at your diagnostic studies, including MRIs, and we will go over candidacy and be very honest with people. I saw a couple of consults today, including one gentleman. I told him he was not a candidate. His shoulder was too far gone. He had no range of motion. Unfortunately, I told him that he needed to go get a shoulder replacement. So, we will be very honest with you and give you a honest opinion as to what we can do. And it's not always going to be PRP or stem cells. We have a lot of other things that we do. We're physicians, and we will do procedures as part of our plan, but it's not all that we do either. Regenexx also has advanced nutritional supplements that we do recommend for our patients that are undergoing the procedure. This includes our advanced stem cell support formula, concentrated fish oil, and a turmeric curcumin complex that really helps to prevent inflammation. So again, the next step is to call us, make an appointment. Call us at 412-963-6480 and schedule a new patient exam. And again, be happy to see anybody. So that's the end of my presentation. And I wanted to address any type of questions that people have. So this is opportunity for people to type in questions, and I will, or if someone has a hand raised, I'll answer them that way. Let me exit my screen here. Okay, so the first question I have is for those who have already had meniscectomy, is Regenexx able to heal or repair the cartilage removal? I would say about 90% of the patients that we treat with their knees have already had meniscectomies. They were so commonly done, especially in the 80s and 90s, and even into the last 10 to 15 years. So the answer to that question is 100% yes. We will so we can not only heal the meniscus, but also heal the arthritis that has set in. For a lot of people, the development of arthritis has happened as a result of the meniscectomy. So the answer to that question is 100% yes. Someone asked me, can I post the number to call for appointments again? I can, then I can say it. If you want to write it down, I'll say it slowly. I don't know if I can go back to my presentation, but it's 412-963-6480. Here, actually, I can share that again. So again, 412-963-6480. Okay, let's keep moving on. I'm 63 and have moderate to severe arthritis to the left hip. The right has been replaced. Also have low back problems. What chances do I have to be a candidate? I don't know. I can't answer that tonight, to be honest. If you've already had one hip replaced, it doesn't mean that your other hip is too far gone that we can't replace it. All I can tell you is I see patients all the time with similar profiles as yourself, and we definitely have options that we can offer to you. So whether or not you would be a candidate for stem cells for the other hip, I don't know without doing a full comprehensive evaluation, but you're certainly not too old. We may have options for your back as well. So certainly would recommend coming in and having us take a look at. Next question is, how many treatments are needed for the hip? And again, this kind of applies to all the joints that we're talking about. If we're going to do a stem cell procedure, it's that 3-step process that I talked about. So that's all one treatment. That's generally done over the course of a week. Hopefully that's all you need. We're not looking at bringing you back and doing this again, say 6 months later or a year later or even 5 years later. So we're looking at doing one treatment to help to heal that problem. Now, can we do another treatment down the road if necessary? The answer to that is yes. And often we will do what's called a booster injection, say 2 or 3 years later, or even 6 months later if necessary. And what a booster injection is an additional dosage of platelets that helps to kind of boost up the healing response that's already been going on in the knee or the hip. So again, we're not looking at multiple different procedures if we're treating a hip, a knee, a shoulder. It's all one procedure, but that one procedure is that 3-step process if it's going to be a stem cell procedure. If it's a platelet procedure, that's just one procedure in the same day. And this kind of goes to the next question is, how are the platelets extracted? Platelets are a blood cell, so we're going to draw blood from you, just like you would if you were having a blood test done or giving blood. So we stick a needle into your forearm, we find a vein, pull the blood out, and that's where platelets come from. They're very good. Our phlebotomists are excellent. If we have any difficulty extracting blood, we can do it under ultrasound. So have no issue getting people's platelets. And then if you're getting a platelet procedure, again, that's all done on the same day. So you come in, we draw your blood, it takes them about an hour to process it. About an hour later, we have your platelets ready to go. And when they're ready to go, we inject them into whatever we're treating. Okay, next question. I'm told I have a meniscal tear on my right knee. Would I be able to drive myself to and from the treatments? The answer to that is yes. It's not a big deal. You're still going to be able to bear weight. Even if you get a stem cell procedure, generally you can drive yourself to and from treatments, assuming everything else is good. So that's not a problem at all. Next question is, will PRP only work for the hip, or you definitely need stem cells? it really depends on what we're treating. If it's severe arthritis, we're going to recommend stem cells. If it's a labral tear with mild arthritis, PRP can work great. If it's something in between, we'll talk about different options. Again, often we will go over the different options with you and you can decide for yourself. I might tell you, hey, PRP is indicated and you maybe will get a 50% improvement with PRP, but if you do a stem cell procedure, you may get a 70% improvement. So that's a decision that you'll need to make, obviously taking finances into account. We're very sensitive to the fact that insurance doesn't cover this, but we also will have a lot of data, a lot of information that we can give to you so you can make an informed decision. So it's not only stem cells for the hip, we will use other forms of, we often will do PRP as well. One other question that I got earlier that's not there anymore is, if I have two bad knees, can I do them both on the same time? The answer to that is no. And the reason is because if we take, when we do a stem cell extraction, we can only get a certain number of stem cells. And if we put half of them in one knee and half in the other knee, then each knee is only getting a half a treatment. So it's better to get one knee done and have that recover. And about 3 months later, we come back and do the other knee. Occasionally we will do two joints at once if it's a big joint and a small joint. For instance, the thumb right here, this is the most common arthritic joint in the hand. It's the CMC joint. So sometimes all we need to do is put like a half a cc of stem cells in there. We can often have a half cc to spare. That can be true with a toe as well. But if you're talking about two large joints like knees, hips, shoulders, we won't do both of those at the same time. So I'm not seeing any other questions. Let me just take another look here. All right, well, I gotta thank you, and I appreciate that from Debbie. I want to thank everybody for joining me tonight. I hope you found this presentation to be informative. Again, I know I'm not going to answer all of your questions tonight. This was just a way of opening up your eyes and hearing options that are out there. My main message is just come and see us in the office. We'll spend the time with you. We'll give you an honest answer, and hopefully we will have good options to help you out. So I want to thank everyone again, and everyone have a great night, and hope to see you soon. I'm going to end now. Thank you.